And thank you for joining us for this Thursday's COVID-19 press briefing. Today, Orange County Mayor Jerry L. Demings will start with a somber remembrance with some key personnel who have joined us here in the room today. He will then get right into the details of the COVID-19 numbers, vaccinations, and testing. The mayor will also discuss the county's emergency rental assistance program and its progress with our citizens. Dr. Raul Pino is here from the Florida Department of Health in Orange County with very important COVID-19 trending and quantitative data here in Orange County. And we also have Orange County Comptroller Phil Diamond, who will give us the latest news and information on TDT collections and revenue. Ladies and gentlemen, we know you will have many questions today, and we certainly appreciate that and your perspicacity. However, we must be brief today as we have a budget hearing with some statutory requirements right after this, so please, I'm asking reporters one question only. So we will begin our press event today with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here as we began the 154th press briefing regarding the pandemic. We started a little slowly today. You'd think that after 154 times we have the mics all figured out by now, but we got there. But as we approach in just another 2 days, the 20th year anniversary of the September 11th terror attacks, of course, that changed America forever. Perhaps it changed air passenger travel across the globe forever. I can vividly remember that day. At the time, I was chief of police here in Orlando, and I recall that President George W. Bush had been visiting a school here within the Sarasota area, I believe it is, and he was in the airways headed somewhere. At the time of the initial attacks, all commercial flights were ordered grounded across America, and that created a lot of pandemonium at our international airport here. And from that day forward, air passenger travel and security at airports around America changed forever. That predated the Transportation Security Administration, the TSA, and I remember the demands on our staff at the Orlando International Airport. The police response was immediate, overwhelming, but not just at the airport, but really across our entire community, because there was a lot of confusion, a lot of fear about what was going on in New York and Washington, Pennsylvania, really meant to the rest of the country. And so it created a lot of fear in our business community here. And we responded, reacted, and here we are today to really remember the brave men and women who paid the ultimate sacrifice on that day. Colleagues that I knew within both the New York City fire and police departments paid that ultimate sacrifice on that day. And we're here today to recognize some of our first responders, and we have from our own Orange County Fire Department some men and women who lead that agency, and today we have the fire chief himself, Jim Fitzgerald, the deputy chief, David Rathburn, the planning division chief, Anthony Rios, our operations division chief, Michael Vida, the communications division chief, Kimberly Stewart Horan, the logistics division chief, John Westmoreland. Please join me in just giving these individuals a round of applause for the work that they do every day. During the upcoming remembrance, we will recognize the National Days of Prayer and Remembrance. Among those who gave their lives in service of others were 412 New York City emergency workers. That included 343 firefighters. I have two sons who are firefighters at this point, and having spent a full career myself in law enforcement, I have nothing but admiration for those who are willing to sacrifice their lives for others and respond to the clarion call of duty. Back in 2001, as the World Trade Center towers fell, we all can probably vividly remember where we were when we were notified and we saw those very horrific pictures. Because of that, here we are 20 years later, President Biden has proclaimed September the 10th through 12th as National Days of Prayer and Remembrance to remember the fallen. So now here we are dealing with another world crisis, a pandemic. So since our last news conference on Monday, August the 30th, Orange County cases and deaths continue to rise. In the midst of the bad news, I will share some good news about where we are today. We do know, however, that the novel coronavirus, COVID-19, is really no joke. It is to be treated very seriously because since Monday, August the 30th, we've added 191 deaths during that past 9-day period of time. The August numbers are still being compiled. The Department of Health and Dr. Pino and the state will share as much as they can about the numbers. I do, however, want to use this as an opportunity to say to our community, there's no better time than today, tomorrow, to go and get vaccinated. Over the weekend, I attended a joint memorial service for an employee of mine who worked right in my office. Not only her, but her husband. They died within days of each other from COVID-19. Their deaths clearly devastated their children, their grandchildren, their other loved ones, and their friends. So it was a poignant reminder for me that the lethality of COVID-19 is serious. But let me share with you where we are. As you all know, we have worked to get an increase in the number of Orange County employees and residents vaccinated. But I'm pleased to report that 72% of all Orange County employees now have one or more shots. That includes 79% of the non-union employees and approximately 63% of union employees. We remain in conversations with the remaining union, the International Association of Firefighters and the local union, in discussions about our firefighters. I remain optimistic that we'll get more of our firefighters vaccinated. There are now 215,997 coronavirus cases reported in Orange County. That's an additional 14.32%. There have been some discrepancies between local and state Department of Health figures, and I know that we're reconciling the numbers, Dr. Pino. As all of you know, in terms of other good news, Advent Health moved down into the yellow status and is resuming with additional surgeries. Their COVID patient census is down from a peak of 1,700 in August to 1,120 this week. That's still pretty high, though, but it is down. Our Orange County Health Services continues to do testing at various sites, and they did so through the Labor Day holiday. We offer testing 7 days a week. We do want to report that there's a change in the hours at the Econ Soccer Complex. Starting tomorrow, it would be open for COVID testing between the hours of 9 a.m. and 4 p.m. The Econ site will close an hour earlier due to soccer games that are happening at that location. The other two sites, Barnett Park and the former Claricona Elementary School, will be open between the hours of 9 a.m. and 5 p.m. 7 days a week. The three sites continue to test over 3,300 people each day. For more information about testing opportunities, you can go to our website at ocfl.net/testing. Camping World Stadium is still offering the Pfizer or Moderna vaccine through our efforts there. Since August the 10th, nearly 4,000 people, to be precise, 3,897 have been vaccinated there. Half of those going to Camping World are getting their first shot. For more information about where you can go to get the vaccine, you can go to ocfl.net/vaccine. I want to remind you that the federal eviction moratorium has expired. So there's an opportunity for our residents to get assistance through our emergency rental assistance program if they're behind on rent payments due to the pandemic. We have provided assistance to date to 1,440 families who have qualified for help with their rent and have been able to stay in their homes. And we've allocated more than $8 million. The program can help eligible residents pay as much as 12 months of past due rent and 1 month of future rent, up to a total of $20,000. Residents can visit ocfl.net/rental assistance to review program details and also view the frequently asked questions. And with that, I'm going to turn it over to Dr. Pino at this time.
Good afternoon, Mayor. Thank you very much, everyone, for being here. As the Mayor mentioned to you, we have a mix of good news and bad news. The total number of cases has risen to 215,997, and our positivity rate for the 14 rolling average has decreased to 14.3. On September 1st, we were at 16.7, so there is a rapid decline on positivity rate. But this is not to say that the pandemic is still active. We still have to protect each other and protect ourselves. And the number of deaths has risen to 1,724. We are reporting today an additional 191 deaths since we spoke to you last. The ages are from 29 to 100 years old, and the median is 71. Of those 191 deaths, 87 were female, 104 were male. The race, 40 black, 10 Asian, 123 white, 1 American, Native American, 1 Native Hawaiian, and 15 of other and 1 of unknown. On the ethnicity, 44 Hispanics, 144 non-Hispanics, and 3 of unknown ethnicity. 91 of those 191 have known pre-existing conditions that we know. 100, we don't know any of those pre-existing conditions yet. 5 of the deaths that we are reporting today were from July of, the month prior, and 186 are from August. 16 of the 191, and that is 8.4%, were reported on people with addresses on assisted living facilities. 41 of the 191, that is 21.5%, were fully vaccinated for COVID-19, as indicated in our records, and 9 of the 191 were partially vaccinated for a 4.7%. 2 of the ones that are deceased now were past due their second dose. So about 75% of the people, as far as we know, that we are reporting today were unvaccinated. Those are sobering news that should not surprise us, as we knew we would get to this point, but it doesn't mean that it's still not shocking that we are reporting those numbers. With regard to OCPS testing hours for this weekend and continually for the next weekends, as we see it right now, has been a decrease in the demand. So we are going to reduce the hours on the weekends. Instead of 10 to 4, we are going to do 10 to 2 p.m. For our employees to have weekend times. Much has been made of a little bit of a percentage difference between what we were reporting and the state on the number of people vaccinated in our county. There is reason for that. We had a conference with the state today. So the state numbers are the official numbers because the state is who reports to the feds. So with that, we are at 70% of vaccination rate for at least one dose. But as we told you before, that percentage could be between 5 and 8% off. I have mentioned this to you before, because it depends when you calculate, when you extract the data, and because we are constantly cleaning the data, those numbers are going to change. And as long as the changes are up, it's all positive. So we should celebrate that we are at 70% of vaccinations. For the total number of deaths, your question is going to come next. For August, we are at 293. The month before, July, we are at 63. And the month before, that is June, we were at 31 deaths. There is also important for people to know that in our efforts to do trace investigation and contact tracing, we have primarily focused right now on the schools. And although the numbers are declining, it's still a significant number of cases that doesn't allow us to get to all cases on the day they are reported. We are taking several steps to correct that. And part of that is going to be also, we are in the process of hiring additional staff from OCPS. They are going to work as part-time positions with the Department of Health, helping us with the schools and do the trace investigation in the schools. The response from the employees of CPS has been great. We received 275 applications that we are processing, and because of the large numbers, we are going to pause on accepting new applications until we finish with this bunch, because they have to go through a process of vetting, training, and giving them access to all our data sets. In closing, the pandemic seems to be improving in our county. The data indicates that hospitalizations are decreased. Number of cases have decreased from week to week. The reduction from the prior week to last week, it was at 26%. So that's a significant reduction. But we are now facing the consequences of the high wave that we have a couple of weeks ago. And we knew that these numbers will be significant due to the number of cases that were hospitalized. Remember that about 50% of the cases in ICU will be, we have high mortality rates. So that is a significant number. We also continue to prepare for the events of vaccinations in schools. And we are working with the states and OCPS to be able to offer testing in each of the schools. That's going to take a little bit of time, but that's where we're moving forward. Instead of offering in the 7 regions as we are, we will offer every day during school hours in the school, but that requires some investment, a little bit of work, and about $32 million a year that will cost. And we are in the process. We have the resources. We are just designing, putting it together, and probably by December or even before that, we could be offering testing in all the schools during the school hours for students who are symptomatic and asymptomatic. With that, I will pass it to Phil Damon and answer any question that you may have after.
Thank you, Dr. Pino. Before I give my report about the July TDT numbers, I also wanted to express my gratitude and thanks for our first responders, whether it's the firefighters in our community or law enforcement, police officers in our community, and really every community that keep us and our loved ones safe. And whether it's at a time like September 11th or any other time, I think it's always the right time to say thanks for what you do. I'm here to report on July TDT collections, and in a word, the news is good. The collections were for July of 2021 were $24,702,900. That is a 376% increase over July of 2020. On a month-over-month basis, July collections beat the previous month, June 2021, by about $3 million. And July 2021 collections were also higher than July 2019 collections by about $2.1 million. And that's significant because, number one, this July's collections were higher than any month since the pandemic began. And this July's collections were actually higher than the amount we've collected for any July since we first started collecting the tourist tax. So it is clearly a very good month. You can see in that chart where July stands, and that's also included in your press information. Obviously, that's very, very good news. However, you've heard two reports already this afternoon from Dr. Pino and Mayor Demings about the continued threat of COVID-19. And clearly, the threat and reality of COVID-19 do continue to weigh over Orange County and over our Orange County economy. It wasn't that long ago that Florida was labeled as the epicenter of the COVID pandemic, and it also hasn't been that long since our hospitals were at code red. Clearly, until the virus is controlled, it will make it challenging to continue this sort of results that I was able to report to you today. On the TDT expenditure side, the county had to dip into reserves to meet its monthly TDT funding obligations. As you'll see in your TDT cash reserve summary, our renewal and replacement account decreased by about $1.8 million. And to summarize, we've used about $145 million of reserves since the pandemic began, and that brought our undesignated reserves from about $181 million down to about $35 million. So about $145 million of reserves have been used since the pandemic began. We will have our August TDT collections for you in early October, and I will be happy to answer any questions during the question and answer period. And with that, I'll turn it over to Mayor Demings.
All right, thank you, Controller Diamond, for the update. Again, a bit of good news there. I did want to share one thing before you all asked me about it. We had an inmate who was in our custody at the Orange County Jail. He was booked on August the 12th. The inmate was transferred to the Orlando Regional Medical Center on August the 13th and admitted that same day, exhibiting symptoms associated with COVID-19. So we believe that at the point that he was arrested by law enforcement, he was already positive and booked into our jail. The inmate went back to the jail. He was transported back to the jail on August the 24th. He had remained in the hospital. The inmate then went back to the hospital on September the 4th and was admitted that same day. And unfortunately, I have to report that the inmate succumbed to his illness early this morning. He was a 66-year-old African-American male. His death is believed to have been caused again by COVID-19. So I share that with you as well. Our staff at the Orange County Corrections Department has been working diligently to ensure that we did not have an outbreak at our jail, but it's very difficult because of lifestyle decisions, et cetera. Individuals who are booked into our jail come from the community in which all of us live, and so we know that it was just a matter of time before we had someone that was in our care and custody that one would test positive, two that would likely die of the disease, just like what is happening in our community at large. So at this point, we're going to transition to open it up for any questions that you may have. If there are questions in Spanish, we have Mrs. Yesenia Negron, who will translate for me, perhaps for Controller Diamond. Dr. Pino is fluent. We also are joined by Orange County Commissioner Mari Uribe and also Maribel Gomez Cordero. We have our Convention Center Executive Director Mark Tester, who is in the audience. We also have Mr. Scott Howard from the Orange County Public Schools, who has joined us as well. And so with that, we will open it up for any questions that you may have. Okay, we're in the front.
This is Steve Hudak from the Orlando Sentinel. I got a bunch of questions, but I'll stick with one with Dr. Pino. It's like playing Hollywood Squares. So how do you account for 293 deaths in August after 31 in June and with the adjusted figures, 62 in July? What happened here?
Well, it happens that after great efforts to get over 1 million people vaccinated in our county, the reality is that there are a number of people who are unvaccinated, and the large majority of the deaths are among unvaccinated people. These vaccines are very good on protecting against illnesses and death, and that unfortunately was ignored. Of course, we have also a number of cases that are breakthrough cases, and with the Delta variant coming into play, that also play a role in the high number of cases that we have seen. It's very infectious, but also as the mayor said it a few weeks, this was mostly a pandemic, or at least this wave was mostly among unvaccinated people. And I know this will not serve of any consolation to anyone, but imagine if this Delta variant has arrived prior to we have high vaccination rates, what could have happened? And that's the issue with prevention. That is also very hard to prove because you already prevented. So it could be that our cases could have been double that if we have not started very quickly vaccinating as we did in February. Among all that is also the good news that we have reached 70% and probably higher than that when we get the data from the VA. and other federal institutions. It could be that we in reality are closer to 75%, at least with one dose. And this is going to be a wave of variants. So what the new variant will come or when it will happen, because remember, every transmission is an opportunity for mutation. Every time that the virus transmits from a person to another, you got the chance of a mutation. And that's what you do with vaccines. And that's why you wanted to get to herd immunity, because you want to prevent that transmission from happening. Individual will still get it, but you will be preventing transmission. And that's important as well.
Lauren Seabrook, Channel 9. My question's for you, Dr. Pino. There had been a conversation not that long ago that it would be nearly impossible to reach herd immunity at this point. But with the numbers being, like you're just saying, above 70% likely, and when you look at all the people who have had COVID-19 over the last 2 months, so there is some natural immunity in the community, is it possible that this is the last time we'll see a wave this high, or do you think the next variant is just too close to let that happen?
I think that Delta show us not to predict what the virus is going to do. And the mayor said it, it is deadly. It's not a joke. And, there are very stubborn news when you, in 10 days, add 191 people to the death row. And we knew that this could happen and that it will happen. We didn't know how high, but 191 is a stubborn number.
Holly Bristow, Fox 35 News for Dr. Pino. In the midst of your numbers, you said someone was overdue for doses. Was that a second dose or a third dose in those
Second.
deaths? And of these older folks, do you know how long it had been, like the nursing home folks, since they had received their second vaccine? Had it been 8 months?
The average was 145 days, about 5 months.
Dr. Pino, Danielle Lama with Fox 35, just revisiting Lauren's question. So even though we've hit that 70% threshold, at this point, we won't be able to reach herd immunity?
So when Lauren was asking the question, I was thinking about the answer, and I forgot to say this part, is that as you see, the national narrative is moving away from herd immunity and using that word for a few reasons. First, it could give a false sense of safety when you say, okay, we have reached herd immunity, and people who are not vaccinated may feel protected by the number of people who are vaccinated. And Delta show us that that's, an iffy proposition. The other piece is that determining herd immunity cannot be global in that sense, because it also depends on the conditions at the local level, meaning depending on transmission, number of people who leave, and number of people who are vaccinated, et cetera, that number may be different for Orange County that is for Lake. So it's very difficult to put a number on herd immunity. Now, reaching 70% was the objective of the federal government by July 4th, and we didn't get there. Now is that we are getting to that point. And, the higher that we get, no matter what the number is, the better that is for all of us. But 79%, 80% is where we will achieve in those protections. But, in some childhood immunization, in some states, herd immunity is achieved at 90% or 89%, depending on the vaccine transmission and what is going on in the community.
Buenas tardes, Alibet Suárez con Noticias Telemundo 31. Mi pregunta para Dr. Pino. Básicamente preguntarle sobre por qué hubo esta discrepancia en los números de 67% a 70% y qué significa que justamente se llegue a este 70%.
So her question in Spanish was why we have a discrepancy in the numbers with the state, and also what it means to reach 70. So the second first, to keep it with the tradition, 70 is just a number. It doesn't have significant in the sense of achieving protection for the community, but it illustrates where we are in moving ahead and increasing this vaccinations number. So 70 by itself is just a goal. It doesn't mean anything from the pandemic point of view, just that we have reached 70% of the people immunized with at least one dose. But it's just one dose. We need people to get their second dose, and we need people who are qualified for the booster right now to get their booster. With regard to why we have a difference, so there were different factors. I'm going to explain you one that it gave us the larger number. So in the data, and this is going into the weeds, and people can get confused, but I'm going to say this one. So you have, when you give the address, it also say county of residence, and it also asks for the zip code. We, meaning the state health department in the central office is running with county of residence. And we were running with zip code. So that gave us the difference, because there are a number of people who have the county of residence but didn't have the zip code. And those were excluded from our numbers until we get to those cases and clean, because we are cleaning the data. But that requires manually to look for the address, read the address, enter the address, geocode the address, get the zip code where that person lives, and then it gets added. Now, because the process is very tedious and slow, you will not see a significant number of increases every time that we clean the data, because it's 20, 40, 50 a day. But there are more than 40,000 people that are in those numbers.
En español,
Oh. Okay. Well, I did in English, so let's do it in Spanish now. En el caso del 70%, no tiene ningún significado especial. Solamente significa que hemos llegado al 70%. Desde el número de protección, por supuesto, más en personas están protegidas, y mientras más altos sean esos números, mejor. Pero 70 no es donde estamos felices. Felices vamos a estar en 80 y 90%. Con respecto a por qué hubo diferencia, explicaba en inglés que en la base de datos tenemos el county que la persona reside, el condado en el que la persona reside, y también tenemos el zip code. Nosotros en Orange estábamos corriendo la base de datos con el zip code, pero hay muchos que esos zip codes no están correctos, o que tienen el zip code del sitio donde fueron vacunados. Entonces, en el proceso de limpiar la base de datos, que lo estamos haciendo despacio, pero hay como 40,000 personas que tienen errores en el lugar de residencia, y esa es básicamente la diferencia que teníamos con el Estado. Pero como dijimos en inglés, el Estado y los números del Estado son el reporte oficial, no los del condado. ¿Cómo es?
¿Ya se alcanzó el 70%?
Ya se alcanzó el 70%. Y debemos estar un poquito más alto. Es un poco más alto que el 70%. Tal vez esté alrededor del 75%.
Mayor Demings, Dave McDaniel, Wedge TV. We just passed a long holiday weekend again. We know what the 4th of July brought us a mess. While numbers are improving, they're still high. Transmission rates are still high. I mean, we're 14% better than 20, but certainly not the 5 that everybody wants. How concerned are you as football stadiums and other sporting events are packing them in, often without any masks, what the community's going to see 2 weeks from now?
Well, I don't know. Unfortunately, I don't have a crystal ball, but more than likely we're going to see some incidents of super spreader situations at some of these large scale, crowded outdoor sporting events. So that's something that all of us should be concerned about. Again, I believe that if we want to keep our commerce open, the safest way for us to do that is to get vaccinated and to wear facial coverings, especially in those crowded settings like that. One of the things I will tell you, I got my first shot right here in the Orange County Commission chambers back in December of last year. So with the urging of Dr. Pino, I have received my third dose of the vaccine. I had Moderna, and I didn't have any type of symptoms related to that third dose. And so when I stand up here and I advocate for others to get the vaccine, I do so with the full confidence that I myself have done it and have not been adversely impacted by it. And I do that to make certain that I'm protecting myself, I'm protecting my family, I'm protecting my father will turn 99 on this coming Sunday. So, you know, it's important to me that I protect my family. So I'm asking everybody else, do the same thing. Protect yourselves, protect your families. For the last several weeks, you've heard me come here and tell you that. I've gone to funerals. I've been in the hospitals. And for those who still somehow have not even resolved amongst themselves that this is a deadly virus, it is unbelievable in many ways to me. But we said months ago that if we continue to live through this pandemic, this experience, sooner or later, each one of us will know someone who tested positive. Each one of us will know someone who became seriously ill. And each one of us will know someone who would have died from this virus. So here we are today. I continue to ask you, yourselves, does it concern you? It should concern the entire community, not just me, about these crowded outdoor events. I know we're all fatigued. We've all want to be over COVID-19. But Dr. Pino has told you that each time that virus is transmitted from one human to the next, it has the opportunity to mutate. That means it changes. It can become even more deadly and clever in how it moves amongst the human race. So we have some challenges. You know, we want to live our lives. I certainly want to do that. I want to go out and socialize. But I want to do everything that I can possibly do to keep myself safe, as well as keep other people safe. So that's the burden that we have in these public roles that we have, is to make our decisions for the greater good, for the greatest number of people in our community. And so I remain focused on that. Okay. That looks like that was the final question of the day. The next press briefing will be on Monday, September the 13th. We certainly hope that all of you all, during your various opportunities to remember 20 years ago and see if there's anything we learned from that experience, please do so. It's a day, a period of both prayer and service, and so perhaps you will have the opportunity to be of service to others. We will conclude this press briefing. We have our first budget hearing this afternoon, and at 5:01 p.m. it has to start precisely at that time. So those of you who may have one-on-one questions, we ask that you try to do those very quickly, because we do have to clear the chambers and prepare for that budget hearing. Thank you all for joining us.